at a very rapid rate, particularly after the age of 40. So when you see elderly people, and they're frail and weak, it's likely due to the fact that is not just that they aged and that's what you're supposed to look like. And I think that that's what a lot of people think, but the truth is that they just didn't get enough protein. They were not feeding their bodies properly, and they probably weren't exercising and strength training, right? And the reason they weren't is because they probably didn't know this information, right? And they just not, again, talked about enough. But protein, how much do you need? Well, great question, right? And the basic, simple metric that I use, particularly for clients who, just want to age in a way that is, we're not bodybuilding. We're not, we're not doing it in an excessive amount, right? This is for the just average person to age in a way that is healthy and to prevent disease. Okay. And it's 1 gram of protein per 1 pound of your goal weight. If you have excess fat that you want to lose. So let's say, for example, you weigh just for, you're 200 pounds and you want to lose, 50 pounds. Then you want 150 grams of protein a day. And I know what you're thinking, that's a lot of protein. And how do I get that? And that seems like a lot to track. It's not. It's actually very simple. Just knowing how many grams are in what you would typically eat, and tracking, you literally have to track for maybe a week to figure that out. Okay. A week of your time just tracking for the benefit of the rest of your life is totally worth it. So again, protein, I want to just talk more about what sources. Even if you're a vegetarian, there are ways to get that much protein a day. Okay, it is not hard. So again, protein allows for what? Anabolic health, meaning we're feeding the muscle that we currently have. Super important. Also, it allows our bodies to regulate our blood sugar. I talked about that earlier. When you regulate your blood sugar, it does a few things. It satisfies your appetite. Protein is very satiating. What does that mean? That means that you're going to be less likely to reach for things if you're eating the adequate amount of protein that aren't serving you. You're going to curb cravings. So that's what that does. It just curbs those cravings. It's like almost like a natural GLP-1. If we've heard about these peptides, that's huge in this space. And it's really becoming more mainstream. There's a ton of side effects to those. So what I coach and teach my clients is, let's try the natural way first, because our bodies were designed and created to respond first to a natural element, to all things natural, right? And protein is such what I refer to as a cheat code for so many things, because not only are you feeding the muscle, but you're curbing cravings, you're staying fuller longer, feeding that muscle tissue. Okay. And it requires more energy of the body to break down. So you're burning calories. Hormonal changes. That's something, our endocrine system. So especially as we age, estrogen is in a huge decline. So when you feed your body the adequate amount of protein, you can balance these hormones. So it also balances mood. If I hear every single one of my female clients struggle with this, and then once they started eating the adequate amount of protein that their body actually needs, all of that leveled. We balanced hormones, balanced blood sugar. We reduced inflammation. We reduced significantly water retention, right? So again, you want to aim for 1 gram per 1 pound of your goal weight per day. So that again is, if you take away anything from this talk, then I would take that away. Okay. Again, muscle protein synthesis and repair. That's another, I could talk about that for quite a while, but if you are strength training, which you should be, you have to feed the muscle protein. Otherwise, whatever efforts you are putting into the gym or at home, whatever weight lifting efforts that you're doing are wasted. You might as well not do it unless you're feeding your body an adequate amount of protein, because muscle does not grow without it. So again, and also it supports our skin, muscle, the muscle tissue. So the tissue around tendons, these things are supported by the protein that we take in each day. And bone density. That's another and critical point. We hear about as we age, bone density has become more of a topic now that you're hearing, because it's a very real thing. If your bones aren't strong, you're much more susceptible to injury. You're going to be much more susceptible if you may fall and hurt yourself. That recovery time is exponentially longer if your bones aren't strong, right? So muscle tissue and building lean muscle is absolutely your aid against that. You're also building bone density with muscle tissue. So again, kind of bringing everything full circle, the lifestyle habits too, of ensuring that your efforts, not only with nutrition, any adjustments that you make there, and any new fitness programs that you introduce, recovery is extremely important. And so the lifestyle habits around getting proper rest are just as important as the stimulus. So if we are not resting and recovering, which is actually when muscle tissue is building, then it won't happen. It's just as important as I mentioned protein is in terms of feeding that muscle. To grow it, we have to be resting adequately too in order to grow that muscle, because that's when it's actually happening, when we're in recovery. Okay, so number one, you need strength training, and it can be a very straightforward program that is 30 minutes, 3 times a week, focused intentionally, intentional form technique and the exercises that you're doing to get a full body workout, anybody can do. So again, the intention behind how we're performing those exercises and the exercises that we're doing is what is going to get the result that you want in the shortest amount of time. And intentional nutrition and understanding that what we're putting into our bodies has a direct effect on how we think, perform, and feel every single day. And supports our efforts in and out of the gym. That, and I'd say, the lifestyle component and intentionally ensuring that we are getting the adequate amount of rest and recovery and regulating the nervous system. We hear a lot about stress too in this space, and ensuring that nervous system regulation is just as important as everything else that we're doing. Because when you're in a high state of stress, the body is just in survival mode and is going to hold on to everything. So that's that lifestyle component that we need to be mindful of. The one value add, I'd say, with lifestyle would be, it's one simple habit that you can get into, if you're not already, would be going to bed at the same time every night and waking at the same time every morning. And hopefully that time in between is 8 hours. And if you're doing that, even if you started with that and you were doing nothing else, you're going to look, feel better, and have more energy. Just that one adjustment. Because what's going to happen is you're going to feel better. And when you're rested, you have more energy. What does that mean? You're going to do more things. You're going to be more productive. Okay. You're going to think more clearly. You're going to want to make better choices for yourself throughout the day. And then those choices then lead to more. And it becomes a sort of domino effect of better, healthier choices that before you know it, you're living a healthier lifestyle without feeling like you've really changed much or adjusted much to what you were doing before. And that's really the goal. And that's the goal to sustainability, is to change one thing at a time and allow the impact of that one adjustment to benefit your life, to see and feel that benefit of the result of that, and then that lead to the next. And again, over time, you're going to feel exponentially better implementing these three components to your life. Again, make that one adjustment to the nutrition, just track protein. You're going to feel better. Start with 1 day a week. If you start 1 day a week strength training, that 1 day is going to lead to 2, right? And because you're going to feel better just from 1. And then those 2 will lead to 3. But what's also really important to keep in mind is that because we can, doesn't mean it's optimal. Obviously, doing what is best for you may not look the same for everybody, but to start and to implement one adjustment that's going to move the needle in the direction of preventing any disease and strengthening your body and aging with power and strength is the goal. That has to be the goal. How we get there is going to look a little different for everybody, but the main pillars of intentional eating, training, and lifestyle habits will work for everybody. And I really hope that, that the information that I have been able to give you today has been helpful, and it's information that has been easy to understand, that you can take and apply. And I really feel very strongly, based on my own, experience, as I mentioned, starting later in life, and having such incredible results from exactly what I'm sharing with you. I didn't do anything different or more than the information that I've shared with you today to get fit and healthy, and I've been able to sustain it for years into my 40s. And I believe that if I can do that, anybody can do that. And that concludes my talk with you today. And I really hope that it's been valuable. And I'm happy to take any questions that anybody has, if that is part of this. This is, again, my first time doing this. So format, I'm not exactly sure how it's concluded, but happy to take questions if anybody has any.
Excellent. Excellent.
Sir, are you there?
So glad to hear you. Very nice. Thank you so much for your thought-provoking words. You have explained everything in a beautiful way. You explained about metabolic health, the significance of exercise, the protein, and the connection between protein and muscles, significance of protein intake, and feeding muscle tissue every day, taking care of muscles by feeding them every day, taking proper protein intake. So beautiful, Tristin. Thank you so much for giving us this wonderful inputs today. So I have a question. The thing is that you mentioned about protein, significance of protein.
Yes.
And I have a question. How to maintain an optimal level of glucose in our system? Give us some ideas to maintain proper glycemic index. Yes, give us some ideas to maintain proper glycemic level.
I want to.
Glucose
I
level
can
in our
answer that.
system.
Sure. Tell me why you're asking.
You mentioned about glucose. I mean, protein. The significance of protein. Every day we need to take a proper intake of protein. Everything okay. Give us some ideas how to maintain proper glucose level in our system.
Okay. That's how. So protein is so powerful and effective that what protein does is it, when I mentioned blood sugar, so the word you've used is glucose. It means the same thing. So when you ask the question about glucose, protein, adequate amount of protein, is the key macronutrient to balance glucose and blood sugar in the system. Okay, so basically what that means is that you're not, it allows the body to not store. I'll give you an example. You know what? I'm going to answer that in a better way. If your meal had rice, most of it was rice, and then you had a portion of protein, what's going to happen to the body is it's going to spike blood sugar. Okay? Because the body is telling you, it's basically saying, if it could talk, it would tell you, you've given me way too much of an energy source, which is the carbohydrate, the rice. Okay? And so what you're basically putting into your body an energy source, but you're not expending that energy. Okay? So it's storing it. So you're increasing your glucose and blood sugar. And what also that's going to do is make you hungrier. Okay? So glucose and blood sugar are essentially the same and operate the same within the body. Okay? So it's not a satiating and satisfying. It's satisfying in the moment because you're enjoying it. We love rice. But the way that the body processes that is very different. You know, your mouth can taste something and it tastes really good. For example, it would be like you can eat the same number of calories in an entire bag of chips that a piece of chicken would provide you. What do you think you're going to feel more full from? The chicken. Okay? And the reason for that is because of the glucose and blood sugar. The signal that you're sending to your body when you eat the chips is, I want to keep eating these. It needs more, it needs more, it needs more. When you eat that protein, you're sending a signal to your body that says, I'm satisfied. That's exactly what what I need. Thank you so much. It's thanking you. When you're eating rice and snacks and sugar, it's telling you, what are you doing? That's not what I want. That's not what I need right now. Okay? I hope that answers your question. You know, I want to be able to translate a question into real life. You know? Does that answer your question?
Yes. Thank you so much, Tristin. You're explaining in a beautiful way. Thank you so much.
You're welcome. I want to say something. I have several Indian clients. So, and they're wonderful. And I have learned so much from them. And in terms of, you know, just the cuisine, and I felt armed with answering that question because rice is such a huge component of the dishes, and which I love it too. And it's okay. There's nothing wrong with it. It's just when do we need that energy source? And typically what I would say, to expand on your question a little bit, limit the portion, okay? And also increase your protein, reduce the rice, and I would say that you can have a little more, or the body will let me rephrase. The body will respond more favorably on days you're active. So you need those additional carbohydrates on days that you may be strength training, on when you're taking long walks. You know, again, that's another protocol that I give my clients that is extremely effective. And that is taking a 10-minute walk after each meal. 10 minutes. Just walk for 10 minutes. That helps to stabilize blood sugar too. So it's kind of expanding on the answer to your question. you're sending a signal to your body. You're sending that activity and walking, not running, nothing excessive, nothing intense. You just want to get some movement in. You can burn 100 calories on a walk, but you're not sending a signal to the body to eat more, right? We're doing a very low intensity amount of exercise that sends a signal to the body, oh, good, okay. And it's helping to promote digestion too when you take that walk. So, and everybody can walk, if you're physically able to, obviously, yes, so we should do that. And so think about if you did 3 10-minute walks a day. That's 30 minutes, and that's a couple hundred calories that you're burning. And it's incredible for mood. It's incredible for just particularly anybody who is stressed, has a high stress, and you need to just 10 minutes to decompress. Like it lowers cortisol. Cortisol is that stress hormone. That's going to help regulate the nervous system. Just in a 10-minute walk. A lot of this is so simple. It really is. Is it easy? No, but I'd say this, not always. I mean, once you get started, it'll become easy because the alternative is this: feeling low energy, being in pain, having disease is a lot harder, right? So doing these very simple protocols is a much easier route to take, I'd say. You just do it. Just start and do it. Implement it and feel the benefit. You will feel better immediately. One good solid night's rest, you can feel better. Eating the adequate amount of protein, try it one day, see what happens. That's what I tell people. I tell my clients, I'm like, just see how you feel. I know that that's what they're supposed to be doing. I know because I've done it. I know because I do it. I live it. So I know I'm coming from a very, real place that I've personally experienced. I want them to experience it and then come to me and say, oh, wow, I don't need to be right. It's not about me being right, but you're welcome to say, Tristin, you were right. This, da, da, da. Or you could just say, I feel great. And I would be just as thrilled. So, any other questions? Questions are great. I mean, I would take the opportunity to ask me. It's like a free coaching session.
Good morning, ma'am, for you, and good evening, all members present over here. So really wonderful presentation what you have made, and definitely it is something not cognitive, informative, but that can be implemented. Many of the times people are coming with the explanatory definitions, but no one gives operational definition. I think you have given operational definition today. So thanks a lot for your wonderful presentation, and what you have said, macronutrient, micronutrient, the nutrients are required for our energy. And for every body cell function is also with the energy. What locomotor activities we are doing, it is with the energy. Your cardiac action, your respiratory action, everything goes with energy. And then you have talked about the BMR, basal metabolic rate, and that is, how we should differ our, intake. Some people are doing a very, what we can call it as a sedentary job. Some people are doing moderate job, and some people are doing a hard work. So I think depending upon the nature of work, also your diet should get changed. If you are a farmer and you're working very hard, then naturally you will have more appetite and more diet. So nothing wrong is that. So there is no golden fixed standard as such for the taking your diet. And then you had talked about the macronutrient, protein, fats, and carbohydrates, and micronutrients. Definitely, they are also playing a vital role in the human body. And definitely, there are certain diseases. What you said that diabetes mellitus is, it is considered as a pan-metabolic disorder. So it is not just a glucose metabolism getting hampered, but you'll find the other metabolism also getting hampered. But I will relate, several other aspects are also there, like, the fertility, then you'll find the migraine-like problems. All they are connected with your food. Allergies, hypersensitivities, so many things are there, the food is a central, if there is no central aspect, the nucleus is not there. If human being is having everything but no food, he cannot survive. So that is wonderful. And one very important point what you made, our cravings and aversions, what we can call it as. So these cravings, our human body is made such a wonderfully that we are having desires as per our requirement of the body. Some people crave, calcium. Some people crave salt. They are taking excess salt. And there is always a difference between two individuals. So I think the human body is made in that sense that, it can understand that, what kind of deficiency is there, what kind of excess things are there. And that is why the aversion also comes sometimes. So wonderfully explained that point, because usually I'm also practicing a homeopathic doctor, but yes, definitely I'm very much close with the nutrition, and we call it as dietetics application of the nutritional knowledge. So we are having that, dietetics knowledge we are giving. One important point I want to make, when we are changing the place, if I'm in the USA, and if someone is at Japan, someone is in India, I think the diet pattern is different. The intake is different. In India, we are having carbohydrate and fats too much. While what I feel, I feel that in USA, we are having more protein and fats. So the obesity, carbohydrate obesity and protein obesities are also there. So it differs from one place to another place. So wonderfully placed, madam. Really, it provoked, evoked our ideas and thoughts, and definitely, we will be implementing it for our patients also. Of course, it is very difficult job to, communicate and provide health education to the patients, because how many times they will accept it, how many times they will not accept it, that is another question. I will not go into that story, but wonderfully placed, how we can use it, this knowledge, nutrition knowledge, day-to-day life, that is very important. My question is, nowadays there are several companies, I will not name them, they are making their business, on the nutritional supplementations. And instead of food and instead of your dinner, you skip your dinner and have this kind of a decoction or something like that. And the people are using it without much, consultation with the nutritionist or doctors, physicians. So what you feel, they are the very strong, they strongly convince us that this is one of the best product in the market, and people get convinced. They are having better convincing power than doctors and physicians, and people are using it. And what will happen, people are going for such a kind of food instead of a natural food, leafy vegetables, fruits, proteinaceous diet like meat, chicken, right? If they are not going with this kind of diet and they are going with some powders, putting in a hot lukewarm water and taking it, what will happen, how to stop them, and what we can give advice, for such people. They are convinced, they are purchasing, they are, they can give any price for this, right? Because some people wants to put up the weight, some people want to lose the weight. That is the only criteria. They are not thinking in the way of protein, fats, carbohydrate. So how we can explain these things to them? So that is my question, ma'am. Otherwise, your presentation was wonderful, right? Thank you. Thank you very much for very informative session. Thank you.
Thank you so much for that. And it was certainly my pleasure. And I really want to speak on this. The answer to your question could be another podcast. Okay. It really, and I'd love for it to be, in a way, because it's that important. And but I'm going to try to, I want to answer it though. What is so let me first say that my coaching, I promote only whole foods. Whole foods. Like there is a huge gap between the impact that whole foods have and a protein powder, let's say. Like eating a piece of chicken is not the same as a protein shake. The body doesn't, it can have the same amount of protein in grams, but here's what happens. If I eat that chicken, I'm going to be full. I'm going to feel satiated. It's going to impact the choices that I make the rest of the day. If I drank a protein shake, it's probably going to be a sweet. That is going to make me want to eat sweets the rest of the day. That's what it's going to do, right? And also, the way that the body processes a shake versus a whole food chicken breast, let's say, or piece of steak or fish, could be any of those, very different. There's a huge difference between a liquid and having to actually process and digest whole food protein. Okay, very different. So physiologically, big difference. So you're not burning any real calories when you're drinking the shake. So what I tell my clients is this. First of all, not all protein powders are created equal. The only one that I use and promote, there's one. It's Paleo Valley's bone broth protein powder. It's very minimally processed, minimal ingredients. It's loaded with collagen and all the amino acid profile that you need. And I use it as a tool. That should be used strategically and intentionally as a tool. So, for example, this is what I do with it. I will brew a cup of tea that I make at night, okay? And I add 1 scoop of the protein, my Paleo Valley bone broth protein powder and vanilla. It's a vanilla flavor. And I drink, that's my dessert. It curbs my sweet craving. It's like a treat. And I'm getting collagen, I'm getting amino acids, and I'm getting 13 grams of protein. There's 13 grams in 1 scoop. And so I'm adding some protein if maybe I was a little low that day. But it's also a treat. That's how it should be used. It should not be used as a supplement for a meal or a substitute for a meal. It's called a supplement for a reason. It should be supplemental to an already whole food lifestyle. The other thing I want to discuss about your question, I think you asked about peptides. I'm not sure. The GLP-1s, what's happening with these drugs that are suppressing appetite is again, I think those, I don't want to go down. This could be a whole other discussion, but as efficiently as possible, I want to just touch on it. What's the easy way out is the long road in the long run, because what's happening is you see these people who maybe took that drug and they're losing their muscle. They're not eating to support muscle tissue. So they may be losing fat, but they're also losing a lot of muscle, which is what we do not want to be doing. It's the worst thing that you can do for your health. So that's a whole other talk, but hopefully I answered your question. I use supplements should be used very strategically. In fact, I don't even use a pre-workout anymore. There are ingredients. I want to say this. This is important, especially for any women that are listening, but it applies to all of us. There are ingredients in those supplements that cause gas, bloat, inflammation, endocrine disruption. You know, it doesn't make sense to try to, to take something to fix or to help you in some way when you're just creating 5 other issues. Because there's ingredients in those supplements like malic acid, citric acid, any type of acid like that is going to ferment in the gut. Okay. And it causes gas and bloat. And these women, and particularly I hear them every single day complain about this, and they think that they're doing something good for themselves, taking the supplement that's like a probiotic, but it's flavored because we want it to, taste good. Well, that taste good, fruity, whatever's in that is extremely detrimental. You know what I say for digestion and gut health? Eat whole foods. Eat the foods that your body actually wants, and your digestion will fix itself. That's, calming vegetables like a sauteed zucchini or squash or cooked veg. That's what our bodies actually want. We want that. We want, and then again, if you're eating the whole foods the way that our bodies are designed to consume them, you won't have the need for any supplements. It'll just naturally work the way that it is supposed to. It is so much simpler. We as humans, I think, especially today, we are marketed and sold so many things, and we want this quick fix. There is no quick fix. And by the way, I don't want that. You don't want that. You want what is going to be sustainable and what the human body is designed to have. Okay. Not much has changed in thousands of years. Okay. Aside from our environment and what we're marketed, there's a lot of supplement companies getting rich off of selling things that are quick fixes when really they are just causing a lot more harm than good. I hope that answered your question.
Thank you very much, ma'am, for wonderful explanation. What I will summarize that, we should have our traditional natural food rather than, the chemical synthetic structures. We should not introduce them. And if required, it should be considered as a supplementation, not like this. No doubt. And there are some food fads now coming forward, we are having, food fads. Maybe last 10 years back, different food fads are there. Now different food fads are there. I think we should not promote those kind of food fads. And, by visiting these places, we are enhancing, their use. So I think we should have our home traditional food, natural food. So that will provide a good amount of nutrition, and that will provide a good health, positive health, physical, mental, both the health. Thank you. Thank you very much, ma'am, for your wonderful presentation. Thank you. Thanks a lot.
Of course, my pleasure. Thank you all. Any other questions that I can answer? I have like 2 minutes.
Yeah, if there is any question, you can ask participants. It's a humble request. And the link is there for your feedback on the group. So please check it out. Dr. BETKAR sir has placed. So please fill up that feedback link also. And any other questions? I think wonderful personality we are having today. So wonderful explanation she has given, and she has not just communicated the book text matter, but I think her experience, what she is giving it to us, And no doubt, if you want to have a consultation of her, you have to pay for that. But if this is the opportunity over here that there is the opportunity to ask question. If you're having question, maybe personal, individual, or maybe general questions, you can ask this question. Thank you.
So nice
Yes,
to hear, Ben. Thank you so much. So nice to hear from you. You've given us a wonderful advice today. We would like to hear from you in the days to come also. If you are free, you can join with us in some other days also. Please join with us. Give us your wonderful advice to us. We would love to hear from you. Thank you, Tristin.
Thank you so much. I welcome the opportunity to join again. And I welcome the opportunity to work with any of you privately. If there's an interest, I have remote clients all over the world. And I can work remotely with any of you to help you and give you custom and personalized coaching. Happy to share the link to work with me. And yeah, so happy to do that. And then too, if we could even do a one-on-one and initial call too before you committed to anything long-term, but that's offered to you for sure. So.
Thank you, ma'am, for your wonderful presence over here. So I take this opportunity to thanks on behalf of Veer Maheshwar Charitable Trust, Latur, India, and especially from Principal Dr. BETKAR, sir, to have such a wonderful resource person over here. So thank you all participants for your great presence. And Dr. BETKAR, sir, is traveling since still he is, try to communicate and try to listen to you. Thank you. Thank you very much. Thank you, everybody. Please don't forget to fill up the link. Thank you. Bye-bye.
Thank you,
ma'am. Thank you. Bye-bye.
Bye, everyone.